Good afternoon, Santa Clarita. This is Tom Burton from Providence Holy Cross Medical Center here for your Providence Holy Cross Health Hour. And as it is heating up out in Santa Clarita and the wind is blowing like nobody's business out there, I was lucky enough to be able to make it up from Mission Hills to be able to join us for this next hour. To really we're going to have a very interesting conversation, and I'm just going to kind of hold on to that for just a second, do a little brief reintroduction of Holy Cross for those of you who are new to the hospital. We're part of the Providence Health System, one of the third largest actually in the United States, kind of branching across, I guess, about 7 or 9 states. There's 50 different hospitals. FACE is part of our FACE, which is so prevalent here, is part of our family. The hospital itself, believe it or not, if you're coming from the Canyon countryside, is actually closer than coming to the other hospital here up on the west side. So at Providence Holy Cross, we're located right around between the 5 and the 405 on Rinaldi, and we've been around for quite a while. Founded back in 1961, we've been able to grow to about 377 beds, and a very busy hospital, being a level 2 trauma center. Most of the area here will be flying in either by helicopter or by ambulance, will be coming into the to Holy Cross to be able to get that absolutely fantastic care. This hospital itself offers everything that you could probably want as far as for cancer care, orthopedics, cardiovascular, just you name it. And frankly, if we can't do it, we will be able to do it, because one of the nice pieces about Holy Cross is we have an administration that isn't looking at today, and they're not really looking at tomorrow. They're actually looking about 5 years down the line to assure that we're going to be able to meet the need of the community and our adjacent communities. And Holy Cross is Santa Clarita adjacent, and we're glad to be able to be a part. Who would use us? Well, I would say about 30% of our patients are coming from Santa Clarita. 30% of our staff actually live here in Santa Clarita, and we are just glad to be able to reach out to the community in a number of different ways. And don't blink, because it seems to be that every week and every month there seems to be something different going on up here that's involving Providence and its growth and expansion to be able to better serve all of our local communities, and which could include our new association with City Hope, our association with Children's Hospital. We just keep an eye out for EXER, a emergency room physician base manned urgent care that will be local to us to be able to give us that extremely high-level care, however, in the basis of an urgent care, which allows for us to have a little bit more expedient delivery of care. So we're really looking forward to all that's going on with Holy Cross, and I do believe that our CEO will be up answering questions in November, and I think there'll be more to come with that. I think it's November 2nd, but the location we're not sure of, but I'm sure that there will be announcements so that way you can actually come out, meet Dr. Bernie Klein. He was on with us a couple months ago. It's going to be over at Valencia, I think at the Country Club, right? Yeah. So you're going to be able to have the opportunity to meet Dr. Klein, who a couple months ago was on with us, kind of going over all the exciting stuff that's going on. And frankly, just glad to do it and glad to be here and glad to be able to enjoy what's coming up here. Now, let me tell you, I was more pleased with the med school being at UC San Diego. I'm a little less pleased, though I am employed by the Pac-12 as well, that the residency for internal medicine was done at that other USC school, and which actually has a tremendous reputation. And I will.
But I'm a Bruin by heart. I went to UCLA for undergraduate.
There is behind
I'm
every
a Bruin.
Dark cloud. There's a silver lining. As starting out as a hospitalist, well, Dr. Marwa Kalani, okay, Dr. K, as I have been told that is very appropriate for, but Dr. Kalani is joining us today on her anniversary.
Yes.
Very excited. And so we're extremely lucky because I think we are the last stop before moving on to a birthday party. Is that right?
Yes, we're going to the Mickey Halloween party tonight. So, yeah, everyone's really excited in our family. So just wanted to, wish my husband, Slava Gofnunga, happy anniversary, 13 years. It's been awesome.
That's
yeah.
Amazing. What's the secret?
Lots of laughter. Lots of laughter. We have a great time.
Way too good.
Yeah.
And you're busy.
To do it. Yeah, we're both very busy.
Never mind the doctoring thing. Mm-hmm. Yeah, well, I'll tell you, the doctoring thing is being a big deal. You and I had the distinct pleasure, as you were able to care for my mom a bunch of years back. And let me tell you, it made every bit of difference for the entire family, which for us was necessary, and couldn't have been and that was my first introduction also to palliative care. But before you ever started with palliative care, you were a hospitalist for like 7 years. So tell me about the hospitalist component first, because you also oversee the hospitalists at Holy Cross.
That's correct. So I used to be a hospitalist for FACE Medical Group, and what a hospitalist is a physician, usually an internal medicine physician, but family practitioners are also seeking out inpatient level of care. And what it is, it's strictly internal medicine on the inpatient side. It's dealing with hospitalized patients and their medical ailments, helping to coordinate the care for each of those individual patients. And it's really the standard of care as far as delivery of medical care within the hospital setting.
So in essence, so you're the captain of the team, and
right.
You coordinate everything, and that can't be an easy task. That's got to be a bit of a challenge, right?
It is absolutely a challenge for our hospitalists. They are exceptional folks. They have a lot to juggle. Consultants, different medications that they're constantly keeping on track of, the different therapies, really making sure that the patient's plan of care is constantly moving forward. And it's a huge responsibility. And the thing that some providers on the outside don't realize is that they're just too busy to come into the hospital setting and provide this level of care, which is much more intense than it used to be.
Right.
And now that it's been so complicated, the hospitalist movement, it started about 15 years ago, but has really taken over that level within the inpatient setting. And so there's fewer and fewer primary care doctors who are coming to the hospital because of how difficult it is to manage inpatients.
That and, having spoken with a couple of them, they actually said, roughly around that same time, the requirement to see more patients became so great that they were running out of time and quality of life and the such like that. So the role itself has been able to really bring a higher level of service, if you will, to the patients. But I think that coordination of care is a really big deal. At the hospital, at Holy Cross, because we're a trauma center, you might be juggling 8-9 practitioners to assure that everything is going smoothly and everything is moving along. So that's an unbelievable chore, and having the opportunity to work with a lot of them, and it's not an easy task. Now, over at Holy Cross, we have 3 very large medical groups. They have their own hospitalists. We have contracted hospitalists, and that to be able to have all of these groups all work together as a team, no easy task, but you're doing it with grace. So.
Right. And my role really as the chair of the hospitalist committee at Holy Cross is just to really facilitate more education to the hospitalists, any of the concerns that the hospitalists have on the other end, concerns about the hospital quality or anything in that regards, I help to really facilitate that conversation. I no longer operate as a hospitalist, but I definitely advocate on behalf of the hospitalist. So we're really trying to meet everybody's needs.
Yeah, which is a great segue though, because as you had mentioned before we came on air, there was a calling.
Yeah.
What was the calling?
I think that I I started off doing palliative care a really long time ago. It actually started back when I was in medical school, and we were introduced to hospice and palliative medicine as a mandatory rotation through our medical school, and recognizing that it was an aspect of medicine that was, number one, really taken for granted, and number two, it is truly a very a very sensitive one. It is the type of treatment that you provide to patients that no other physician is providing, and it's really about whole person care.
Right.
It's taking all of their medical ailments and processing all of that through a filter and trying to get to understand the patients and their ailments and go beyond and take a step further and really address their spiritual concerns, their emotional, their psychosocial concerns, and making sure that you provide this level of care with a team. And that's the role of how palliative care operates within the hospital setting. So it was something that was introduced to me really early on in my medical career, and after having been a hospitalist for some time, I found that I enjoyed providing that level of care. So I decided to do more education towards it, and ultimately I decided to jump ship from being a hospitalist to doing full-time palliative care.
Now, and just probably within the first few years of 2000, they actually created a board certification.
Mm-hmm.
What was the process that you had to go through?
So to be eligible initially for the boards for hospice and palliative medicine, you had to provide a certain number of visits to patients who were either terminal or end of life, mm-hmm. On hospice level of care. That's one. And two, you had to demonstrate that you were working with an interdisciplinary team within your hospital setting. And you had to sit for a full day examination. So it was an 8-hour exam. And that was the grandfathered period of when you could get certified for palliative medicine, and that ended in 2012. I was able to be fortunately I was able to sit for the boards in 2010 and demonstrate enough to qualify for that certification, and really haven't turned back since 2010, and took on the medical directorship at Providence Holy Cross.
And glad to have you too.
Thank you.
I don't know that it is my hope that everybody gets a chance to meet. And hopefully not to have to experience.
Right.
But in this, it's something too, is that I often think that palliative care and hospice care are often being used interchangeably,
yes.
and it's not. There is a distinct difference.
There is very distinct differences.
So,
and it's interesting because we just had the situation last night on a patient who has newly diagnosed cancer, and she met with our palliative care team. And we had talked mainly about advanced care planning, getting to know who she was, who she lived with. She was Presbyterian, a really delightful woman. And we talked about what other physical symptoms she was having, so we addressed her physical condition as well. And what the nursing had recognized was that yes, the palliative care came in and they were ready to move forward with hospice. Well, actually, we didn't even bring up hospice. So because of that, it is really being used interchangeably. And in fact, palliative care really grew out of the movement of hospice because of the fact that people are living longer with their chronic and serious illnesses, and they don't meet the criteria of hospice. So hospice is really reserved for patients who have a terminal illness, their prognosis is less than 6 months, and they're provided a certain type of care that is really team dependent. So again, physician, nurse, chaplain, social worker dependent. And palliative care operates the same way, but there is no restriction as to the terminality of the patient, the prognosis of the patient. A patient can be newly diagnosed with a disease and can receive palliative care, because we know that these patients have such a serious illness that they're going to need extra support.
Right.
And that's basically what palliative care is.
It's interesting because I was reading up because I didn't know much about it.
Right.
I still don't know a ton, but there was something that I had read, and they said that basically that it works to ease the way for patients and their families. And
yes.
And I thought it was a very poignant way of putting that was that hospice, to my understanding, was at a point in time where medical intervention is no longer curative.
Exactly.
Where else palliative is assisting the patient through the medical process to be able to get to the next step or to
That's
the next
correct.
step from that. And it doesn't, and that next step isn't, most of the time, isn't always palliative, isn't always end of life. It's going
Right.
to actually be just that in between on that difficult aspect. And sometimes, the cure is actually rough. And it's quite involved, and and some of the medications can seem toxic, and that you're helping them with every aspect. And that part that I really dug about it was that, and something that I experienced when we met first, was the fact that it is really directed. It's directed somewhat to the patient, but
Yes.
the patient pretty much has the easy part of this.
Yeah.
It's really to the family, right?
Yeah, it is very patient family focused. So, I mean, all of the care that we provide, especially at Holy Cross, is patient family focused. But this takes it to another degree.
Right.
And the nice thing about it is that, yes, a lot of times the patients they're not really experiencing a lot of the anguish that the families are experiencing, because they may be too tired from their illness. They may be, dealing with their pain or other symptoms. And the family's really the one who's advocating on behalf of that patient. In that situation, we have to take care of our families too, because they're the ones who are also struggling along with the patient. So it's important that we take them as a complete unit and treat them really as a unit rather than just the patient.
That's interesting. And when I was rounding this morning, one of the gentlemen that I was working with, he had mentioned that he was going to be going to a skilled nursing facility after his surgery. Mm-hmm. And for the main reason is he said he just doesn't feel stable on his feet yet. And I said, sometimes that's a wise choice, because his wife was actually with him in the room, because I said that we need to make sure your wife stays healthy. We need to make sure that she's okay, because if she's not doing well because maybe she hurts herself in helping with fall recovery or what have you, that's not going to be healthy, because she's going to need to be on her A game to make sure that they can get back to their A game.
Absolutely.
And the family is such an important piece, and I think that's one of the nice parts about Holy Cross is that one is it does carry that atmosphere familially. Mm-hmm. Not to mention that I think we actually have a lot of family people working there.
Yeah.
And for most of us, we've either been patients there, we've had family that are patients there. Some of us. This guy was born there. So there's a real good chance that there's plenty of family around, in and around, within the hospital. And so that family atmosphere is going to be hugely, hugely important.
Right. And what's interesting is I'm part of that Holy Cross family too. My parents both worked there. I joke that I think my mom breastfed me in the parking lot. Had my first stitches there. I was 2. And it is very much so. And in fact, there was one weekend where I swear there were probably more visitors and family than patients. So it is very much so.
That is actually the case. It's amazing. And parking will demonstrate that on occasion,
yes.
Right? So I know we're coming up to our first break right now. You're hanging out here with us with Providence during their Holy Cross Health Hour with KHTS AM 1220, your hometown station. We'll be right back.